to do, what do we do first? We identify our patient. The first thing we're going to do is we're going to introduce ourselves, explain to the patient what we're going to be doing, remember to get consent, and then we're going to identify our patient. Once we're 100% sure we know we have the right person, then we're ready to begin. Then we're going to set our supplies. What I want you to do is you can take this lid off and place it on the table top side down so that the inside doesn't get contaminated. And how many cotton balls?
Two.
We need 2 cotton balls. And this needs to stay clean, so we're going to place it back over here. And we also need alcohol. We have little alcohol dispensers here. I like to split my table up into 2 sections, the dirty section over here and the clean section over here. Okay? Don't have clean stuff mixed over here with the dirty things, like the sharps container and the basin is all dirty. Okay? So, man, can you, well, you would identify yourself. I'm not going to have you do that on camera, but you would identify yourself. Remember, you would spell your first and last name for me. Okay? Then I get my supplies ready. What I want you guys to do is to have everything ready to go. So one of the first things you're going to do is get your tape ready. I'll get the tape ready like this by peeling off a small amount of tape, placing it on the back side of my left hand because I'm right-handed. And then if you guys can please turn this in like this so that it's not so hard to find the next time. Okay? So the first thing I'm going to do is I'm going to have you come forward a little bit more. And I'm going to put the tourniquet on. Remember, 3 to 4 inches above where I'm going to stick. We're going to put the tourniquet nice and firm. And I'm going to have you cup your elbow with your other hand. So this hand is going to cup the elbow. What that does is it actually straightens out your elbow. Now sometimes people have a tendency to pull back when you're drawing blood, but with this cup underneath, they can't really do that. So I'm going to have you make a fist. And what I'm going to do first is I'm going to start to feel for that vein. Now she's got a really big vein there, and it feels firm, so I know it's a good vein for phlebotomy. But I'm going to study 3 things, and I want you guys to catch this. There are 3 things you need to study about that vein. First of all, where is the center? Okay, so I'm going to tap across to kind of hone in on the center. So we need to find the center first. Then I'm going to, as I'm feeling for that vein, I'm going to assess how deep I think that vein is. Is it really deep or is it real surface? I happen to have really deep veins. Yours is real surface. Okay? So I know where the center is and I know how deep it is. I have an idea of how deep it is. The third thing that you need to look for is the direction that the vein flows. Is the direction going this way? Or is it going this way? Or is it going straight up the arm? So I need to start studying the direction of the vein. Right? So we're going to study the center, the depth, and the direction of the vein. Now, because she has a really good vein that I can see, I don't have to worry too much about where I'm going to put that needle in when I'm ready to stick. But if you were to stick someone like me where my vein is deep and you can't necessarily see it, once you find the center, the depth, and the direction, you're going to use something on her arm to landmark that center of that vein. Remember, this is a vein you can't really see. And so you're going to landmark. What would be some landmarks on a person's arm that you can use? Well, hair might be a landmark. You can say, I have hair on my arm. Or a freckle might be a landmark that you might want to use. Or a red spot. So you need to get in the habit of finding the center, the depth and the direction, and then landmarking that spot so you have a reference of where you're going to put the needle when you're ready to go. Okay, does that make sense? But in her case, she's got a really good vein. So notice how I took the tourniquet off because the tourniquet cannot be left on for more than 60 seconds. So now that I have a vein that I'm going to stick, I'm going to go ahead and prep it with alcohol. You're going to take your cotton ball and just pump it. It dispenses alcohol. And what we're going to do is we're going to clean the skin using firm, oh, that's a lot of alcohol. We're going to use firm, a circular motion. So we're going to go from small to larger circles. And we're going to just kind of let that dry. We're not going to dry it with dry it with cotton. We're just going to let it air dry, okay? Now, I put a lot of alcohol on her, so normally you don't put that much, and 30 seconds is enough for it to dry, okay? While that's drying, you need to prep your syringe, okay? So what we're going to do is we're going to take this syringe packet. Remember, you have these little arrows that tell you that the peel apart is right here, and you're going to just pull off the backing, throw it in the trash, and then you can just place this down. Now, I like to leave it inside of its sterile cradle because I really want to make sure that I use sterile technique for this procedure. If I take it out and place it on the table or place it, on the patient's bedside, it can become contaminated, and I really want to keep it as clean as I can keep it. All right, so see how it's sitting down in its little cradle. Okay, I'm going to lift it up out of the cradle, and the first thing we're going to do is we're going to loosen the plunger like this. Just pull it down and push it all the way back up, all the way up. Okay, that's called loosening the plunger. Then I'm going to take my fingers and I'm going to just tighten that needle. Hear it? Mm-hmm. Okay, I know that it's tightened. They don't come tightened from the factory. You have to tighten them. Remember I said that if you don't tighten it, when you draw blood, you're going to get little bubbles of air coming in. And you get bubbly blood, and that's not good. The next thing I want you guys to do is I want you to take the syringe in the palm of your dominant hand. I happen to be right-handed. Okay? These 3 fingers here are going to grab this syringe and push it against the palm of my hand, while these 2 fingers here are going to grab the cap. Then I'm going to take this other hand and help those 2 fingers to loosen the cap. I'm not taking it off at this point. The goal is not to take it off, it's just to loosen the cap, and you'll see that the cap is now loosened. That's all I want to do, is I want to loosen it. That's how I prep my syringe. Okay? The plunger is loosened and pushed all the way up. The needle is tightened and the cap is loosened. That's what I want to see you guys do. I don't want you to take it off. I just want you to very carefully push it up. Now I know some people will pull it off like this, but the problem with pulling it off like this is that if it's on so tight, when you finally get it to break loose, what does our brain tell our hand to do?
Put it back.
It goes back. And if the needle is exposed, you might stick yourself. And I really want you guys to develop a very healthy fear of needles, even if they're clean. If you have a healthy fear of needles, even when they're clean, you're going to have a healthy fear of needles when they're dirty. And you don't ever want to get stuck with a dirty needle. So in this class, we're going to treat the needle with as much respect as we can. We're going to loosen the cap just by pushing it up, not by taking it off. Okay? So now that that's prepped and the alcohol is dried, I'm going to make sure I have my cotton ball. I want your cotton ball to be on your non-dominant side. That happens to be my left side. Now that that's prepped, I'm ready to go. So I want you guys to stand up at this point, and you're going to take and put your tourniquet on. Now please put the tourniquet on 3 to 4 inches, but be very careful not to let the flaps of the tourniquet recontaminate your puncture site. What do I mean by that? I mean, don't let the flaps braze across the puncture site. Okay? Now we're going to take our syringe, lift it up like this, and I want to see the needle off the table quite a bit, and then just tilt your needle down and the cap slips off. Okay? You're going to hold the syringe with 4 fingers and a thumb in the middle. Let me do this again. 4 fingers underneath, thumb in the middle. So you're going to approach the vein like this. You also want to make sure that the bevel is facing up. Okay? So what we're going to do is we're going to approach the vein much like the way airplanes approach runways. You know, an airplane approaches a runway like this. It doesn't just drop out of the sky and then land. All right? We're going to pull the skin down, have the patient make a fist. We're going to pull the skin down and we're going to approach the vein like this. Warn the patient, ma'am, you're going to feel a stick in 1, 2, and 3, and just draw the needle in. Now you'll notice that when I let the skin go, it retracts. So follow the skin back with the needle. Also, you'll notice that there's a flash of blood. That means I'm in the vein. You're just going to pull a little bit. Pull your tourniquet off. Keep your needle steady. Grab your cotton ball. You're not going to apply pressure first. You're going to pull the needle out gently, then apply pressure. I want you to immediately separate your hands. This hand goes that way while this hand stays there. I don't want the needle with blood close to your other hand. So separate your hands immediately and then drop it in the sharps. Okay? Once the needle is thrown away, notice how I continue to hold pressure over the cotton ball. I'm going to take my tape. Notice how that was real easy because it was on this hand. Place it on the left side. Attach it to the skin. Pull it over my finger. And I'm going to put it on very, very tightly. Did you see how tight that went over the cotton ball? The reason I did that was because when you poke a hole into a vein, it takes a while for the bleeding to stop completely. It's your responsibility to make sure that the bleeding stops. And the only way to do that is to continue to apply pressure. In the beginning, I was holding pressure with my finger. Now that I put that tape on firm enough, it's going to hold pressure for me. Okay? Have you ever seen people go get their blood drawn and a couple of days later they still have bruises? Oh, yeah. Okay, that's because they're not holding pressure. When you pull that needle out, bleeding continues into the tissue spaces and it can create a bruise after a few hours. So you want to make sure that that doesn't happen by continuing to apply for pressure. We hold pressure for 2 to 5 minutes. Okay? Now, I may not have 5 minutes to sit here holding pressure, but I can put my tape on firmly to keep holding pressure, or I can just ask the patient to keep holding for about another 5 minutes. 2 to 5 minutes is really the standard, okay? If you see that cotton ball is saturating with blood already, maybe the patient's on blood thinners or patient has bleeding problems, then we're going to take it off, put more cotton and more tape, and we're just going to sit there and keep holding it until the bleeding stops. It's our responsibility to make sure that bleeding has stopped, okay? And so that's it. Thank you very much.